So I am pleased to have our speakers this morning. Some of you may recall back in March of 2024, Mateen Abidi, who's there with the camera, spoke to us about mindfulness of Ramadan. It was a wonderful talk. We, I think, did it via Zoom because we were traveling. Well, this morning, our speakers are led by her son, Ali Abidi. Ali is the founder and president of SEHAT, which stands for Securing Equitable Healthcare Access Together. Ali is a sophomore at Onalaska High School, and he founded SEHAT to tackle health inequities via technology and community outreach. He launched the free ApolloHealth mobile application to help underserved individuals find free or low-cost clinics anywhere in the United States. And joining him this morning is Zach Hamman, who is the co-director of events and workshops and is also a sophomore at Onalaska High School with an interest in environmental engineering and rural health issues. He hopes to bridge environmental justice and health access in underserved communities. And lastly, Eva McClung, who is the co-director of social media and is a junior at Onalaska High School, is motivated to join SEHAT after learning about the high costs and barriers in accessing healthcare. She plans to attend law school to help reshape systems of inequality. I am blown away by these kids, these young adults, just even my communication with them has been very professional and forward-thinking, and I can't wait to have you talk to us. So come on up, Ali.
Well, thank you everyone for being here today and for joining this meeting to learn about SEHAT. I hope you all have a good morning and you're having a good weekend. And so we are SEHAT. We stand for Securing Equitable Healthcare Access Together. And today, me, Zach, and Eva will be presenting. Unfortunately, two of our members couldn't be here today, but you'll get to learn more about them in the team section of this presentation. So this presentation is just a little bit about who we are, what we do, and why we do it. Next slide, please. So as we know, timely and affordable healthcare access is critical for the best possible health outcomes. However, there are several barriers to this, such as language, culture, transportation, and lack of health insurance. And all of these result in health inequity and disparity across the nation. As of 2024, about 27 million Americans lack health insurance, and about 23% were likely to struggle with paying their medical bills. And all of this combined results in delayed medical care, which leads to worsened health outcomes and places an increased strain on our medical services. Next slide, please. So looking at La Crosse County specifically in our community, we have 121,000 people in the county, and of those, about 7% or 9,000 people lack health insurance, which is slightly below the national average, but is still a significant portion of our community. In addition, about 5.5% of people speak a different language, which could present a possible language barrier to healthcare access. And even though we don't have county data, we know that 20% of people across the nation are not able to get adequate transportation for their healthcare needs. And so that presents another barrier. And finally, about 12% of people in our community live under the poverty line. So all of this combined leads to a problem, a health inequity problem, that not everyone has equal access to care. And this is due to numerous barriers, including, as we talked about, transportation, lack of health insurance, income, and language. And this prevents many people from receiving the timely and affordable healthcare access that they may need. So as a student, I thought about how could I contribute towards reducing health inequity and trying to help solve this problem. So to do this, I founded SEHAT Inc., which is a 501c3 nonprofit organization that is based in Onalaska and currently serves the community of La Crosse County. So to learn more about, to talk about our mission and who we are, I invite Eva to talk.
So SEHAT strives to reduce healthcare disparities and ensure that equitable healthcare access is accessible for all, regardless of any circumstances that they may be in. And this goes hand in hand with the Unitarian Universal principles of equity and justice for all. Excellent. And then here's our team. So Ali created SEHAT and founded and built ApolloHealth. Caroline and I, we do a lot of the media work, so we actually created the brochures that you guys have, and we made flyers for this event. Grant is our secretary, which means that he does a lot of the record keeping and finances and keeping everything organized. And then Joey and Zach do a lot of the community outreach, which means that they organize events like these. Excellent. And this brings us to our strategy. So to reduce healthcare inequity, building community bridges like through events like these, raising education and awareness for healthcare inequity, using technological solutions, and fundraising. We actually have a GoFundMe currently, and you can find that on our website and also in our Instagram bio. And then I will hand this off to Zach.
So the first part of this is building community bridges, and we do this by engaging with local healthcare and social service leaders about ongoing health equity efforts, exchange ideas, explore opportunities for collaboration. And these conversations guide our next steps and help our leadership understand how community partnerships drive meaningful change. And these are videos of those interviews you can find on our website. Second part is education and awareness. We do this by hosting community events like this one and workshops to help community members better understand health inequity and how it affects families in our area. We also share information about local healthcare resources and support services, so uninsured and underinsured individuals know where to turn for help. We do this through insurance education seminars, low-cost healthcare resources information, and non-emergency transport access resources through online and social media. Abidi. Oh, you don't need that.
No. So another aspect of our organization is technological solutions. So for this, originally I developed ApolloHealth, which is a free mobile application that has a centralized database of free and low-cost healthcare clinics that can help uninsured and underinsured individuals find free and low-cost healthcare across the United States when they may need it. And we're also working more on developing different products, including ApolloHealth, that can help connect patients to the healthcare that they need. So here's an overview of the application. So there's the icon, and you can click on it, which leads to the banner with the logo. And then here is the input screen, where you can enter the information you might need for the clinic. So, for example, you can choose Hughes or current location and the distance that you want to find the clinic in, as well as any medical services that you might need. Next slide, please. So this yields an output page with a list of all of the clinics that has the information you might need, including their name, address, medical services, their distance, as well as links to their website and Google Maps directions for more information and navigation. And so we've also received acknowledgement from agencies such as the U.S. Health Resources and Services Administration and the Wisconsin Department of Health, who've expressed their willingness to collaborate to further enhance the application and publicize it. So that we have another strategy, which is fundraising, and for that I invite Zach back again.
I don't know how these work. So we have launched a community-centered fundraising campaign to raise support for reducing local healthcare access barriers such as transportation and navigation of services. And we are directing funds to local impact by supporting local organizations and school districts, reducing barriers such as transportation, language, and such services.
Thank you. And then thank you for taking time out of your day to learn about SEHAT and supporting us while we are working to create a positive change within our community. Your support not only helps us continue this work, it's also very encouraging. And a special thanks to the Unitarian Universal Fellowship and Amanda Strosahl for giving us this opportunity.
So